It's not the chairs that are comfortable, it's my I have the most comfortable in the world!
Cyanide and Happiness. Number 4, what could possibly go wrong? Right? Today, we're learning about and breaking down the crazy medical type situations and injuries that happen in the dark comedy show. All right, let's dive right in.
This is the most comfortable, oh my God! How is this even possible?
Uh-oh.
It's not the chairs that are comfortable, it's my I have the most comfortable in the world!
Well, it brings up an interesting point. It's very important to have a good chair because of like back support and comfortability. Good, comfortable chair where the pressure is actually distributed kind of throughout your tuchus will be very important. Oh my God. Just sitting everywhere. I like the fact that we got stick figures, but somewhere in there I saw a butt.
You have cancer.
Oh my gosh! That's such a messed up like setup. You can have cancer of muscles, you can have, soft tissue tumors, you can have rectal cancer. So let's see what this doctor is talking about.
It's when you have cancer in your
Oh my God, how could this happen?
Think. Have you sat on anything radioactive lately?
Oh man, sorry buddy. We hear radioactive, it breaks down your cells. It will continue to replicate itself, and that's basically a simple way of describing how cancer cells just continue. It's the same cell, just repeating itself.
How much longer do I have?
Wow, 23 years old and died of cancer. That's horrible. Somebody actually gets cancers at a young age, typically do better. So cancer is not a death sentence. There are some cancers that have treatment, some that don't, some that have a lot of experimental things. There's a lot of different factors that come into play when it's related to cancer.
Grandpa, I don't want you to go.
Don't be sad.
You can see the screen in the back. It's actually a cardiac monitor. Typically, a cardiac monitor will have a lot more things on it, usually an EKG rhythm. And then sometimes you'll see a respiratory rate.
I'll be with you, Grandma. Someday we'll all be together.
This is common. Typically, people who get very sick, their skin changes different colors versus you can see the family members have different color skin. People potentially are elderly or terminal. We know that there's a point at which they're potentially going to die soon. It is hard, it is emotional.
Together again.
Oh, poor thing. If the monitor goes asystolic, which is no beats, you actually just double check to make sure that everything is plugged in correctly. Then you actually check to see if the patient's responsive. A lot of times you'll hear stories where the monitor said somebody was dead, somebody starts CPR and the patient's awake and yelling at them. Oh!
There's nothing! It's the end! Just the end! Darkness all around! Nothing!
What was that? There's something called Lazarus syndrome. This happens occasionally. Maybe a couple seconds later, they actually get a heartbeat back and then the patient dies again. There are accounts of people who have passed away and then come back. Nice feelings per se, not typically emptiness.
They all do that.
What? The nurse just pulling out the plug, turning off the monitor and saying, ha, everybody does that. Not good bedside manner. Typically, you also don't just cover the patient up either. You allow the family to be with the patient as long as they want. You bring chairs, you bring tissues, you bring water, coffee, whatever people need to be with a family member.
A brain transplant takes some getting used to.
I've never heard of a successful brain transplant.
You'll want to get plenty of rest and...
Wait, I got a brain transplant?
Yep, just in time too.
You like the depiction of where the surgery potentially was. You definitely probably going to be bandaged up pretty well after a brain transplant. There could be confusion after you have brain surgery.
Would have been...
Wait, who did it come from?
Oh, some tried to drive his motorcycle off a building and got pancaked.
Whoa. The question ends up being the personality of the brain. Does it continue on because it's just in a new body, but it's the same brain? Big life question there. Oh my gosh, please. Oh my goodness. Okay. This brings up a good point. They actually have a lot of rules and hoops to jump through so you don't abuse the organ that you're getting. Typically, if you're an alcoholic that caused the liver to be destroyed in the first place, they actually won't give you another liver if you continue to drink because you are just going to potentially kill the next liver. Go.
Come on, honey, we can make it. The border is only a few more feet.
So she's running, she's pregnant, you can still run. Is it the best thing to be running and jacking up your heart rate? Probably not. The baby's pretty much full grown. Your ability to perform in the sense of exertion is going to be diminished, but you can still do it. Wait a minute. You're now leaving Canada. Sorry to see you go, eh? Oh my gosh, so stereotypical. We're full, go home. Oh my gosh.
I can't go any further. This baby is coming out
Oh
now.
no.
Not yet. My son.
I don't know if you guys caught that, but he closed her legs. Sometimes babies come out and super quick, or it takes 24 hours or 48 hours. It all depends. Can you actually stop a pregnancy or delivery from happening? No, but you could potentially slow it down a little. Oh my
to help out,
gosh.
eh? Listen, Barbara, when I tell you to push, I want you to give it everything you've got.
Wait, what?
We've only got one shot at this, Barbara.
What the heck? Oh my gosh, okay. There are definitely rules about babies being born in the United States. They will be a U.S. citizen at that point. I didn't make the rules. Oh my gosh! No. In real life, when somebody is in labor, we put them in a position called the Mick Roberts position, which is actually in the stirrups when their legs and their knees are kind of up towards their chest. Sometimes the baby doesn't want to come out, so what you end up doing is doing suprapubic pressure to get the baby's head to go down to get underneath the bone. Nobody's jumping on the belly, nothing like that.
Now pinch the nose and give
Okay,
2
coach.
rescue breaths. Good.
Oh, they're doing CPR. All right. Lift the chin, pinch the nose, 2 rescue breaths. Okay. Breathing is important, but chest compressions is more important. Get them to the hospital so we can get them other medications. But the survival rate, unfortunately, of somebody who's gone into cardiac arrest is pretty darn low.
Now continue the chest compressions.
1 and 2
Good.
and 3 and 4. Chest compressions are done at a rate of 100 times a minute. You do it to a song in your head. Staying Alive is classic, but there are a lot of other songs out there. But remember, you got to do it hard and fast. Oh my gosh, his dummy is alive.
I'm alive!
That individual did good CPR. What is happening?
Oh my god! Oh my god!
The creepy music. What? Wow. This guy just did pillow therapy. What the heck? Does it actually work? You typically can breathe through it unless you're getting your airway collapsed. Nobody does that. Don't do that. If anybody's interested in learning CPR, BLS, ACLS, in the United States, the American Heart Association does courses all over the place. A lot of times they're done at schools, universities, colleges, that sort of thing. You could actually have somebody come and teach everybody, and then you could be certified. And the certification lasts for 2 years, and then you need to get recertified if you want to keep it. This was crazy. It was awesome. It was really entertaining. I was kind of shocked and taken back at some of the scenes that I saw, but I liked it. If you guys like this, check out more craziness with these other Cyanide and Happiness reacts that I did. Thank you so much for watching. Stay healthy, my friends.